So there's so many issues that occur in the gut after your gallbladder has been removed. In this video, I'm going to show exactly what I see when it comes to gut issues after you've got your gallbladder removed. Howdy, I'm Dr. Islam, board certified gastroenterologist trained at the Mayo Clinic. Visit us up at gastro.com for more information. We can see your patients today and get you taken care of. So when someone comes to see me who's coming in for nausea, vomiting, abdominal pain, bloating, acid reflux, there's a lot of different reasons why this can be the case. Now, it's interesting that a lot of these patients may not respond with acid reductive therapy, like a PPI. What is going on here? Well, in a lot of cases, this may be due to what's called bile acid reflux. So your gallbladder is an organ to store bile. And normally you need that organ just kind of as a storage area to help produce the bile or help push out bile whenever your body needs it. Now, if you remove your gallbladder, guess what happens? You remove the storage organ for the bile. And so bile would just shoot everywhere like a water hose, just spraying everywhere, which can go into your stomach and into your colon. Now, if it goes to your stomach, it can cause what's called bile acid diarrhea. And this is a very common reason why you may put a patient on a PPI and they don't respond. So in this video today, you can see here, there's a lot of yellowness and irritation and erosions in that stomach from the bile that's being there. Now, erosions are what I call pre-ulcers. So not ulcers, but on the verge of going into ulcers. A lot of reasons you can develop erosions: H. pylori, NSAIDs, alcohol, tobacco, stress, but also bile. In this case, you can see a whole bunch of yellow substance in that stomach that's causing the bile to occur. And this individual had a lot of what's called bile acid reflux. So what did I do? Well, there are a couple things you can recommend. There are certain lifestyle changes I recommend. So obviously adding more soluble fiber can help out. So that can help absorb that bile to make it easier for you to not digest. Number two, minimizing fatty foods, because we know that fat will trigger bile to be produced, which will make more bile to go into the stomach to cause that water hose to shoot out even more. Number three, minimizing fats that you don't need to have. So non-healthy fats, processed foods. Number four, making sure that you can include as much healthy fats as you can in a slow manner. And then number five, hydration will help out as well. There are some supplements that can help out. Oxybol has been shown to help out to bind up bile. Keep in mind, whenever you recommend a supplement, always know that these supplements may not be the best thing because we don't know quite what's in them. But Oxybol may be one that we do recommend. But certainly, medical therapies can work. In this case, we use a medication called Carafate. Now, Carafate is a very effective medication when it comes to helping out with bile acid reflux. It can come in two forms: a big old horse pill or even liquid. The horse pill is a lot easier because it's typically covered by insurance. You don't have to go through a prior authorization, whereas the liquid can be easier to digest, but it's hard to get that approved. For Carafate, a couple things you have to kind of be aware of. So keep in mind, it can absorb a lot of other things besides bile. So you have to have this either a couple hours before or a couple hours after some of the pills that you take. Number two, I usually recommend this to take as needed based on your symptoms. So it can be up to 4 times a day, or maybe twice a day, or maybe once a day, depending on how people feel. I have people titrated based on how they feel. And one of the side effects before Carafate, besides the fact they can absorb other pills that you may be on, is that can cause constipation to occur as well. So just be aware of that. But having your gallbladder removed can be necessary. But for a lot of our patients, they can cause a lot of gut issues, and this may be due to what's called bile acid reflux.